When last month, Nevada's governor unilaterally stripped doctors of the ability to prescribe the drug outside of hospital settings. That's pretty much what the FDA advised last week. Well, my next guest is leading a group of doctors suing to have that order overturned. His name is Dr. Bruce Fong. He's the president of the Nevada Osteopathic Medical Association, and his attorney, Joey Gilbert. All right, doctor, we hear all the time how unproven or risky could kill you, hydroxychloroquine. I mean, regular, people are tuning in for the first time like, well, I'm not taking that. What have you found, and why are you suing for the right to prescribe this?
Well, what we've actually found, Laura, is that looking at just the same thing, and I really appreciate Dr. Smith's diatribe earlier, is that really we're not seeing an increased rate of these side effects. I mean, just like you've been saying, medication's been used since the 1940s. The side effect profiles are well known. In the people that have used this, there hasn't been a significant increase in the rate of these side effects. So really, just to take this, to introduce what we are, I'm the president of the Nevada Osteopathic Medical Association, and we have decided to file a lawsuit against this emergency order that was enacted by the governor, as you mentioned, back on the 23rd of March, which restricts the use of this medication to only hospitalized patients and only recently also possibly to the ERs. But Laura, I mean, just like everybody's been saying, and I've been espousing for the longest time as well, there is a huge critical therapeutic window that needs to be utilized for us to get this medication.
Okay, are you saying, and Joey, you can chime in here, is your client saying that people could die because they're not getting this type of therapy that might work for some patients? We're not saying it's a panacea. We're not saying it works for everyone. It doesn't work when you're about to be intubated. I mean, that's not, when there's a cytokine storm going on in your body, it's probably not going to work, probably too late. But could people be dying because they're not getting one option here? Could they be?
Laura, absolutely. Joey Gilbert, thank you for having us on. People couldn't just die. They are dying. People are dying. If this is not used in the therapeutic use window, which is a sensitive time period for each and every case is different. It depends on who you are. 90% of the population, maybe 85% are going to be fine. But it's that 15% of high risk that are going to die. This doesn't get sick. You get put on a ventilator, you have a 20% chance of coming off that ventilator, but you got lung problems for life. I believe this is about money. I believe it's about panic and creating, just a whole swath of problems for Americans. But at the end of the day, this is a safe medication. It's been around 70 years, and we're seeing the results, tens of thousands across the world.
And Laura, I mean, really from the most basic standpoint, the Nevada Osteopathic Medical Association is pushing this because we feel that this order, because it's this denial of the ability of the doctor to treat the patient the way that the patient and the doctor have determined their problem, determined a treatment, and then also the timing of that.
Yeah. For the governor to step in between, I mean, all these people are always like, it's between the doctor and the patient. When it's an issue like abortion, right? Doctor and the patient. But when it's COVID, no, the governor has to step in. All right, Dr. Fong and Joey, thank you very much, both of you, for joining us. We're going to be following this lawsuit very, very closely, and coming up.